Hey everyone, welcome to my presentation. I'm Sonia Tuaru. My presentation will focus on managing absenteeism, turnover, and retaining staff. Let's dive into my presentation. Today's demanding healthcare environment. Organizations are facing ongoing challenges such as absenteeism, staff turnover, and retaining of qualified staff. These issues disrupt patient care, straining remaining staff, raising operational costs, and adversely impacting patient outcomes. High absenteeism often signal deeper issues, while staff turnover, especially among experienced nurses, creates knowledge gaps, increased training costs, and weakens team cohesion. These challenges highlight the urgent need for strategies to create a supportive workforce. Understanding absenteeism. Absenteeism refers to the habit of missing work with or without a valid reason. Some absenteeisms are planned, for example, a scheduled day off, planned vacation time, and even attending medical appointments, while others are unplanned, meaning a sudden call out of work without prior notice. Causes. Causes of absenteeism may include poor work environment, employees injured or they're sick, poor communication with leadership, lack of flexible scheduling, and even feeling alone and unappreciated at work. The result of absenteeism heavily impacts patient care and other staff as well, as this increases their workload and delay patient care, compromising quality of care. How can absenteeism be managed? Managing absenteeism can be done through mindful initiatives aimed at creating a positive work environment in ways such as encouraging participation in committees. When staff are involved in decision makings, for example, scheduling or patient improvement committees such as skin and falls, they are more likely to feel valued and part of the organization and are more encouraged to be at work each day. Wellness initiatives. Nurses work in a very high stressed environment. Promoting physical and mental well being is vital for their support. For example, creating a safe space that staff can decompress during their break, and even stress management workshops are a great idea for staff to be able to have ways of managing their daily stress at work. Accountability is also established, and staff are also reminded on absenteeism policy and to ensure to plan ahead for the days that they would like to be off instead of calling off work. Turnover. What is staff turnover? Staff turnover represents the rate at which nurses are leaving the nursing profession. Nurses are leaving due to voluntary or non-voluntary reasons. Voluntary reasons may include they are tired, burnt out, working very hard, can no longer manage working at the bedside, also low pay with the money they're working, they're unable to create financial stability, and having a work-life imbalance also impacts their life. They are also moving away or even retiring. For non-voluntary reasons may be related to being terminated or laid off from their position. Implications of staff turnover. Staff turnover has a significant cost to healthcare. Turnover rates for bedside nurses in hospital has climbed to a rate of 17.2%. This has resulted in an annual cost of $4.4 to $6.9 million yearly for hospitals. This is due to the need to hire new staff and the training that it requires. Filling a vacant RN position may take up to 3 months or longer, leaving vacant spots and inadequate staffing. Each replacement can cost up to $82,000 in training and even the recruitment process. Since staff turnover has become one of the major problems in healthcare over recent times, here are some strategies to reduce this situation. Job satisfaction. Job satisfaction begins at the core of staff being well compensated with salaries and bonuses or yearly increases. Remuneration packages are also well appreciated in the form of continuing education opportunities and a clear pathway for career enhancements. A healthy work environment begins with trust, transparency, and a positive workplace culture where employees are not overworked but have adequate staff and resources to get their job done. Safe staffing ratios are also important in keeping staff in hospitals. Nursing assignments are balanced and promote safe patient care. Nurses are able to manage caring for their assigned patients without feeling overwhelmed. Encourage collaboration. Teamwork and team building strengthen staff, creating a work environment that is supportive and offers a sense of belonging. Why is staff retention important? I have listed three important reasons why I believe staff retention is important. One, for reducing the nursing shortage. Two, reducing staff turnover cost. And three, retaining experienced nurses. To effectively address nursing shortages, hospitals should focus on retention strategies, which we talked about earlier. Listening to nurses' needs and improving their working condition can go a long way in retention. Offering competitive salaries and safe working conditions will allow staff to feel the sense of security and belonging to the organization. In reducing turnover costs, it's important to identify the main causes that are causing nurses to leave bedside. One major cause would be burnout, lack, and also lack of career development. Investing in mentorship, offering competitive salaries, and clear paths for advancements can help lower turnover rates and the cost associated with hiring new staff. Finally, retaining experienced nurses. Retaining experienced nurses is extremely crucial in maintaining quality patient care. Experienced nurses are needed to mentor and train new staff, and also their expertise is invaluable in managing complex patient population. In keeping experienced nurses, recognition programs should be in place to recognize senior nurses and involve them in decision makings and creating an opportunity for continuing education for them. This will promote team building, encouragement, and commitment, ensuring that these nurses feel needed and respected in healthcare. We will talk about staff retention techniques. I have identified three important staff retention techniques. The first one is positive workplace culture. A toxic workplace causes employees to leave, resulting in high turnover rates and absenteeism. No one wants to work in a strained work environment. Positive workplace culture encourages respect, inclusion, and open lines of communication. Teamwork is a vital part of a positive workplace culture in nursing. This brings forth a sense of community and strong workplace relationships among team members. This in turn lowers absenteeism rate, increases productivity, and encourages high retention rates. Recognition and rewards program. Recognition serves as a key element of employee engagement. It's only human to have the desire to feel appreciated. Work life is a significant part of one's life and identity, with so much time and effort invested at work. Without recognition, employees can feel demotivated, disengaged. This in turn increases absenteeism and leads to even searching for new opportunities. A rewards program is a great way to show appreciation. Say thank you. with a gift card for food at the cafeteria. Encourage staff by bringing treats to say, "You're doing a great job." Staff recognition is also a great way by saying thank you, keep up the great work. Involvement in decision making. When staff gets a say in decision making, it goes a long way in allowing them to feel their thoughts matters. Collaborative decision making, for example, staff inclusion in governing council where employees hash out decisions and say what works and what does not work. Problem solving to implement what works best to improve patient care. Nurses' input improves a failing system as the decision was made by nurses for nurses. We will talk a little bit about evidence-based study on retention. As I was researching on this topic, I came across this study and I found it to be very interesting as it's based on survey data from registered nurses who participated in the Michigan's nurses study. Feist and colleague looked at nurses' employment pattern and their plans in 2022 and 2023. And this is some of the results of that study. Some nurses say in 2023 it was a better year compared to 2022. Although they are much happier in their job in 2023, they still have plans to leave or cut back their hours. Nurses are also reporting that staffing levels are better, but are still holding to the need for some states to implement the safe staffing ratio. They also said turnover rates in hospitals are at a rate of 20%, with management not fixing internal problems but adding more staff to fill vacant spots. Nurses are also saying they're concerned that no one is listening to them and management is not creating open lines of communication. So they are leaving their employers, not their profession. What can management do to improve turnover rates, decrease absenteeism, and retention rates? 1. Mentoring. Mentoring nurses and even new nurses offer a way for nurses to feel supported as they go through their career. This mentorship offers guidance. They're able to ask questions and have answers, which in turn builds their confidence with them having feeling there's someone there to support and guide and help them through their day at work. Career advancement. Investing in training and education paves the way for nurses to climb into leadership positions. When nurses perceive clear opportunities for growth within the organization, they are more likely to stay engaged and committed. For example, providing tuition assistance for nurses to be able to further their education and advance their careers. Recognizing employees, a simple thank you or a simple great job makes a significant difference. Acknowledging hard work and celebrating achievements, both small and even the big ones, boost staff morale and demonstrate that leadership genuinely cares, values its staff, and is celebrating the excellence within their employees. Motivational theories are a great way for management to be able to know what's important, what need is important for their staff, addressing staff's basic needs such as equitable pay, safe staffing ratios, and even providing equal opportunities is a great way of fostering that sense of purpose within their staff and also cultivate a work environment that fulfills both personal and professional needs. To add to my presentation, I will discuss and provide some information on how COVID-19 impacted the nursing profession in relation to absenteeism, turnover, and staff retention. COVID-19 pandemic has presented significant challenges to the nursing profession, as we have all seen and were a part of during that time. This resulted in alarming high rates of absenteeism and staff turnover among nurses, especially. Nurses were confronted with a multitude of issues during this time, some being exposure to the virus, personal illnesses, and even mental health strains from burnout and fear of infection. This intensified their struggles during this time. According to a CDC report that was published in 2021, absenteeism rate was an all-time high at 7% during this time. Stress levels increased for nurses. Many experienced nurses opted to resign during this time, and some of them even retired early due to the emotional and physical fatigue the pandemic brought on. New nurses were left at a loss. They were working in a difficult environment with inadequate guidance. There were no clear way of treating the pandemic virus, and with the amount of deaths around them, this caused many of them to leave their role at the bedside. This resulted in very high turnover rates. These concerning trends highlighted the urgent need for healthcare organizations to strengthen the support system that they have in place for nursing staff and to invest in mental health resources, as some nurses are still trying to process and cope with the thoughts and memories during the pandemic. They are encouraged to implement safe staffing ratios so that nurses can have the amount of patients that they feel they are able to take care of on a daily basis. Enhancing working condition is also vital in retaining the nursing workforce, as the nursing workforce is one of the most important workforce in healthcare at this time. Thank you for listening to my presentation. I hope you learned a lot, and the following slides will provide you with the references I used to compile my presentation. Thank you so much.